Seemed like it was a good day yesterday, the investor call. Talk to us about this leaner, meaner, more acquisitive. First and foremost, where would you want to be more acquisitive?
Well, look, we're an innovation-driven business, and in the medical technology space, there's lots of different end markets, lots of different technologies, and as much as we innovate organically, we do need to supplement that with some inorganic investment. And basically, we're not buying mature companies. We're buying early-stage technologies that we grow into standards of care. So we don't buy growth, but it's more growing what we buy and turning some of these acquisitions into new standards of care in healthcare.
Geoff, where excites you right now? You've been focusing organically on tackling heart problems, on combating hypertension. Where would be the best fits from an inorganic perspective, therefore, in terms of innovation?
Well, we're focused inorganically really on what we call tuck-in technology acquisitions to complement our existing businesses. So we recently did a deal, for example, in diabetes. In the diabetes space, we really focus on insulin-dependent type 1 diabetics, and our technology basically replicates the function of a pancreas through a diabetes pump, sensors on the body, and sophisticated algorithms that drive that pump to replace the function of the pancreas. Now, what we just purchased, for example, is a smart pen company called Companion Medical that takes a very similar clinical outcome to the multi-daily injection, or more like the type 2 world. You get that similar outcomes with a lot less hardware. You don't have a pump, you just have a pen you can put in your back pocket and a sensor. So that'd be an example of augmenting an existing business with a technology purchase.
I'm curious how nimble you've had to be in a pandemic when a lot of elective surgeries have been shut down. How has that, if at all, made you rethink some things?
Well, it really, the lessons learned from the pandemic did go into our thinking in terms of some recent org changes we made. We learned in the pandemic, like we're one of the world's largest ventilator companies, and as I'm sure you recall, there was a huge spike in demand for ventilators, and at the same time, physicians wanted increased functionality, like remote monitoring and remote programming of ventilators, so the healthcare staff didn't have to go into the room. So we really focused on this, and organizational boundaries came down, layers went away in our company. We just focused, and it was amazing. The innovation that we were able to accomplish in such a short period of time within that pandemic window. The second piece, I would say, is we did some creative partnerships. We actually open sourced one of our ventilators, put all the designs out there on the internet for everyone to see, and said, anybody can help us solve some of these challenges we're facing, please speak up. And sure enough, we partnered with Intel on a more powerful chip for inside the ventilator, SpaceX for a very important component of the ventilator that's difficult to make. And then an automotive company out of Vietnam helped us with the motor. All of this really expanded our functionality and the number of ventilators we can make.
Such silver linings amid what is a huge dark cloud that is COVID that we still face, right. And that cloud is sort of darkening once again. You are in constant contact with the hospital executives. You are at the coalface, really, to a certain extent, Geoff. How worried are you about the ongoing rise, this so-called second wave?
Less worried than we were even a month ago. Over the last 3 weeks, I've probably spoken to 100 hospital CEOs. And I can tell you, and I'm talking mainly in the United States, and there's a strong, they believe they've learned how to safely conduct elective procedures during COVID. And there seems a real commitment from these hospitals to keep elective procedures going, even if there is a second wave or a spike in cases. So we feel good about it.
We've also had some companies talk about how this pandemic has made them rethink their supply chains. Give us insight into your supply chain and if there has been a further push to make sure all of it, 100%, is in the U.S.
Well, 100% in the U.S. it will be tough, but what we do have is business continuity plans. And really, this really started for us during Hurricane Maria a few years ago. We had a lot of our products coming out of Puerto Rico that was hit hard by the hurricane. And after that, we learned our lesson and really have business continuity and second supply sources for almost everything. So we feel good about that. The other lesson we learned about the supply chain, it gets back to what I said earlier, we have not looked to the supply chain for innovation as much as we should. So now we're out there, instead of giving our suppliers, here's a spec, please fill it, we're giving them, here's a problem or an opportunity, help us solve it. And we're going outside of the healthcare space as well, like I said before, into places like even the automotive space for help.
Geoff, it's not often in this current environment that we hear of businesses pivoting towards a growth mindset and saying that you're going to be ramping up growth to 5% annually versus 4% previously. You've taken on leadership of this business in an incredibly torrid time. Coming in CEO April, we see not only a health crisis, but of course you're in the healthcare area, but an economic crisis and a social crisis to a large degree. Kudos to you, and you're looking at your board of how diverse it is, women, people of color. How have you faced this as a leader? What's galvanizing you at the moment? How cognizant are you of all the challenges that you face?
Look, at Medtronic, we're blessed with a mission that was written by our founder, Earl Bakken, 60 years ago. And it's very comprehensive, especially for something written 60 years ago, with 6 tenets. It talks about putting patients first. It talks about the personal worth of all employees, no matter what ethnicity or gender. It talks about being a good corporate citizen. And that, in times of crisis, pulling that mission out and really re-examining, it really provided a massive clarifying source for us and really made what some people think were big decisions. It made them really easy for us in terms of, inclusion and diversity and equity, in terms of putting patients first, i.e. putting the ventilator out there online. That's putting patients before profits. And in the end, it's made us a better company.